Hey, here's to all my pro-mandate fuckface friends who complain about not enough hospital beds. Why do you think there aren't enough hospital beds, you dummies? You think because too many people are getting sick? There aren't enough hospital beds because we run a for-profit healthcare system, dummy. And the ICU beds are the least profitable. So what are they doing? They're underfunding the ICUs. So that's why there aren't enough ICU beds. There weren't enough ICU beds in 2018 when we just had the regular flu. They were treating people in tents outside of hospitals from coast to coast because of the fucking flu. Why? Because we put our resources in healthcare where they can make a profit. We don't put our resources in healthcare where it's needed. That's why. Now, here's more. We already covered this once. We're going to cover this from a different angle again. Opinion. Do the unvaccinated deserve scarce ICU beds? Why are they scarce? How about do smokers deserve? How about do alcoholics deserve? How about do drug addicts, people who OD, do they deserve ICU beds? How about people who drive recklessly? How about people who are like rock climbers? How about the people who are obese? How about diabetics who keep eating sugar? So should all these people get ICU beds?
Jimmy.
Or is it just some people who don't follow that one rule? Go ahead, Kurt.
Medical care is a privilege that you earn with money and good behavior.
That's right. Ha! Biden unvax will overwhelm hospitals in winter of illness and death. Unvaccinated COVID patients push hospital system past the brink. Really? Really? It's the COVID that's doing that. It's not the fact that we have private equity firms staff our hospitals at maximum profit and the least amount of redundancy. So as soon as there's any kind of outbreak, like a regular flu, the regular flu also overwhelms the hospitals. They don't tell you that.
Boy, I bet those monoclonals would have come in handy for this problem, huh?
They would have. Here's from ProPublica. ProPublica says overwhelmed hospitals face a new crisis. What would that be? More COVID fuckers who aren't vaccinated? No. No. Staffing firms are cutting their doctors' hours and pay. What?
Oh, good.
Yeah. The country's top employers of emergency room doctors are cutting their hours, leaving clinicians with lower earnings and hospitals with less staff in the middle of a pandemic. But listen to Howard Stern and Don Lemon and Rachel Maddow, and you blame your neighbor for this, not the people who are running shit. Get angry at each other. Stay fighting. Stay divided. Team Health, a major medical staffing company owned by the private equity giant Blackstone, is reducing hours for ER staff, emergency room staff, in some places, and asking for voluntary furloughs from anesthesiologists, the company confirmed to ProPublica, in the middle of a pandemic where hospitals are overrun. You fucking chumps. Multiple emergency room providers working for a main competitor, KKR-owned Envision Healthcare, said their hours are also being cut. Even as some hospitals risk running out of room to care for COVID-19 patients, demand for other kinds of healthcare is collapsing. This irony is straining the business models of hospitals and the companies that staff them with doctors and other medical professionals. Hey, here's an idea. Maybe we don't have a for-profit medical system. Maybe we don't that. You know, they have we don't have a hospital with a business model. How about we have a hospital with a healthcare model?
What do you want the government to do how they did with the vaccines and get them to everybody as quickly as possible?
Most emergency room doctors are direct employees of the hospitals where they work. Did you know that? Historically, the doctors belong to practice groups that contracted with the hospitals. In recent years, private equity investors started buying up and consolidating those practice groups into massive staffing companies. Reduced hours are also hitting doctors employed by SCP Health, another medical staffing company backed by the investment firm Onex Corporation. According to internal memos obtained by ProPublica, U.S. Acute Care Solutions, backed by the private equity firm Welsh, Carson, Anderson & Stowe, said it's cutting hours in some places while increasing staffing elsewhere. And why? To increase our profits, not to meet the needs of our people. The staffing company said they're responding to dropping revenue as non-coronavirus patients avoid the emergency room and hospitals cancel elective procedures. The companies also emphasized that they're not cutting physicians' hourly rates, but by assigning fewer hours to doctors and other providers, such as physicians' assistants and nurse practitioners, the companies are effectively paying them less. It also means that some hospitals have fewer clinicians working in the emergency room at a time. The steepest cuts so far have occurred at Allerton Health, whose private equity backers are New Mountain Capital and Fraser. This is how we run our fucking healthcare in America. This is nuts.
The best healthcare system.
What's that?
The best in the world?
The best.
Except by literally any metric.
Yeah. The best healthcare system in the world if you don't use anything to measure it. The company says emergency room visits are down as much as 40% nationwide. I thought hospitals are overrun. In addition to the benefit cuts that ProPublica first reported on Tuesday, Alteon is furloughing some clinicians for 30 days to 6 months and won't guarantee any hours for part-time employees, according to company memos obtained by ProPublica.
Well, now they have more time to write letters against Joe Rogan. So see,
there you go. It all works out. Anyone not willing or unable to share the burden will need to be terminated to preserve employment for those who really feel part of our team and care about their coworkers.
Do doctors need a union? Is that what I'm seeing?
Seems like everybody
it's like
needs
Amazon?
A union. Seems like everybody needs a union, right?
Oh, my God.
In an earlier statement posted on Alteon's website, CEO Steve Halsclaw said ProPublica's earlier article mischaracterized Alteon's actions, saying, "We have not cut clinical rates for providers in the field. In fact, ProPublica reported that Alteon wasn't cutting rates, but was cutting hours, and fewer hours at the same rate amount to lower earnings."
Oh, my God.
Okay, here we go. It was worded in a way to make it sound like we weren't affected by this, but by cutting our hours, we are, said an emergency room clinician who works for Alteon and has had hours reduced in a hospital with coronavirus patients. The clinician, like others interviewed by ProPublica, spoke on the condition of anonymity because company policy prohibits their speaking publicly.
Jesus Christ.
Yeah, I know, right? When they're saying clinician pay is not affected, it certainly is. That was a straight lie, the clinician added. Healthcare workers are being applauded in the streets, and we're being stepped on by them. Team Health initially told ProPublica that it was not instituting any reduction in pay or benefits. However, the company is, in fact, paying some clinicians less in the form of reducing their hours. The company provided a new statement saying, "We are not instituting any reduction in rate of pay or benefits as our emergency physicians face current challenges." An emergency room clinician who works for Team Health said, "I probably wouldn't have complained as this situation is unprecedented, but to see Team Health blatantly lying is infuriating." While some emergency rooms in New York have overflowing with coronavirus patients, in many places, people are staying home instead of going to the hospital. Studies have repeatedly shown that much of the care provided in the emergency room is for non-life-threatening issues. At SCP, salaries for nurse practitioners and physicians' assistants will decrease in line with reduced hours. The company said in a memo on Thursday, employees who don't accept the change will be terminated. We know that this time is also difficult and uncertain for each of you, and we want all employees to be able to focus on getting through this time with as little worry as possible about their pay and benefits while avoiding unnecessary exposure to COVID-19. SCP Health is using its reasonable best efforts to retain all team members at this time in light of this unforeseeable pandemic. SCP spokeswoman Maura Nelson said the company is dealing with a 30% drop in patients nationwide, while the patients its providers are treating are more seriously ill. We are calibrating our clinical coverage according so that we can address more flexibility the needs of our client hospitals. This was a necessary adjustment as we weather the crisis together. The pandemic strain on the economics of healthcare industry is not limited to private equity-backed staffing companies. Hospital operators are also announcing layoffs and pay cuts in the middle of a fucking pandemic where people are screaming about overcrowded. That's why you got to get vaccinated, because you don't want to clog up the hospital. Clog. They're fucking firing people left and right, furloughing people, laying people off left and right, reducing the staff at emergency rooms left and right. And you're a fucking chump if you believe that you need to get vaccinated so that they cannot clog up the hospitals. You're a fucking chump. And if you say that to someone else, you're a propagandist. Dallas-based Tenet Healthcare said it would furlough 500 staff members and borrow money. We have the crisis going on where hospitals need as many people as possible, and at the same time, hospitals have to cut their budgets, said Brandon Jones, a nurse anesthetist, as part owner of practice group called Greater Anesthesia Solutions in the Phoenix area. Doctors are being sidelined or they're being let go completely. It's a great system we have, huh? While Jones' colleagues are out of work for elective surgeries, he said they're redeploying their skills to help treat COVID-19 patients, in particular by intubating them for breathing machines, which puts providers at a high risk to catch the goddamn virus. They're wearing hazmat suits donated by a nearby nuclear power plant, Jones said, and they're helping out even when they can't bill it or stand to make much less than normal.
Hey, that's one of those positive stories like the homeless Girl Scouts.
Yeah, that's nice. They're doing it because they're doing it because it's the right thing to do. Isn't that nice?
Till a local nuclear power plant stepped up to the plate.
So again, you're a sucker and a chump of the highest order, and you're a propagandist if you use the argument they're going to clog up the hospitals if you don't get vaccinated. If you use that argument, you're just spreading propaganda, and you're having people turn on each other instead of holding the people who are actually responsible for the lack of beds in the ICU, which are our establishment private equity oligarchs. That's who you should be angry at. And I'll join hands with you to scream for more ICU beds and to make our system be more flexible to handle things like that. I'll do that, but I'm not going to join hands with you to demonize people who get sick because there aren't enough beds in the richest country in the world. And you're a fucking asshole if you use that argument. You're a fucking dumb, stupid asshole on purpose. Okay, anything you'd like to add to that, Kurt?
I would say if you use it confidently, you're a dumb, stupid asshole. You could say it like, well, yeah, but what about the hospital beds? And that's acceptable to me. But if you're like, but what if you clog up the, indignation?
Okay. I'll grant you that. I will grant it. Please let the record show that I
fact check context.
I agree with Kurt, and we needed to have added context to that statement. We added a second show, January 26th in Raleigh, and we're going to be in Philadelphia on February 20th. Go to jimmydorecomedy.com for a link for all our tickets. And while you're there, become a premium member. Get access to all our premium videos.